here. Heather Berner. Dr. Woolridge, I see you. Chief Proa. Jordana.
I'm here, this is Jordana.
Thank you. Tony Carazino. Nikki?
Did you say Nikki?
Yes. Nikki,
Oh,
gotcha.
yes,
Thank
I'm
you.
here. Sorry.
Thank you. Heather Miller. Jacqueline Evans.
Hey, Jackie's here.
Thank you, gotcha. Steve Pro, did you just join us? Okay, Tony Huma. Chief Pro, were you able to get on? Ann Stafford?
I'm here. Thank you.
Chris Ramos.
Present.
You, gotcha. Debbie Johnson?
I'm here.
And Dr. Ziegler.
I'm here.
Let me go one more time. Chief Proa, Tony.
Yes, sir. Repro
Okay,
here, Kurt.
Gotcha, Chief Proa. Thank you. Tony Carazino, Heather Miller, Tony Huma. Okay. We have quorum. Dr. Woolridge, thank you.
Great, thank you. Hello, everybody, and welcome to the March 16th Pediatric Advisory Council meeting. And I would like to call us to order. And thank you, Adam, for doing the roll call. First announcements is that of the attendance report. I didn't see that specifically as an attachment, but if anyone has any questions about that, they can ask Shelley to send that out. Please be aware that attendance is important here, where we meet quorum and vote on items, and participation is desperately needed in all of our council meetings. If you miss more than 2 consecutive meetings, then Shelley will be reaching to you to confirm that you are still able to remain on the committee. Obviously, this is an open meeting for anybody who wants to join as non-voting members. And we do appreciate all the participation. We do not have any vacancies at this time. Please note that in the agenda, you can link to the schedule for all of our meetings scheduled out quarterly for 2023. Okay, if there's no other comments or questions, I'd like to go ahead and move towards the Bureau reports on the agenda. First up is Chief Garcia for department updates.
Good afternoon, Dr. Woolridge and members of the committee. We are sharing with folks that we are in the middle of legislative session and want to make sure that everyone knows that the Bureau of EMS and Trauma is available if there are any questions. We also continue to do 5-year reviews of rules, and we are specifically looking at our ambulance rules and trauma rules right now. So if there are any questions, please let us know, but we are actively engaging stakeholders and have and will be sharing all information on our website for any upcoming changes. We'd like to introduce some new Bureau staff. We have with us today Sebastian, who has joined us as our newest first responder FR CARA grant project coordinator. We've embarrassed him now 4 times today, reintroducing him to everybody that's been joining our public meetings. We also have Jim Archer, who is our newest enforcement team member. and also Julia Vinton, who most folks know and have worked with from this committee. She has most recently accepted a promotion as the Bureau Services Section Chief. So congratulations to our newest team members and recent promotions. We appreciate you. And I will pass it next to Dr. Bradley to talk about naloxone leave behind.
Thank you, Chief Garcia. So I just wanted to do another announcement regarding our naloxone leave behind program. The Bureau is excited that we were awarded an additional 4-year grant from FR-CARA to address the naloxone leave behind program. This is going to go live here within the next few months. We are very fortunate that the Education Committee earlier today did approve the training curriculum, so that should be finalized shortly. We are also in the process of updating our method for ordering the naloxone along with distribution to EMS agencies, and excited to have our partnership with the University of Arizona Center for Rural Health, who is helping us to develop the resource guides that will be specific to your geographic location. As we get ready to go live with the program, we will make sure we share that information via our Gov Delivery initiation, also all 4 regional councils, as well as our different EMS listservs that we have access to. So more information will be coming in the next few months, and we look forward to that program going live. Thank you.
Okay, thank you very much. Dr. Bradley, the next on our agenda would be to discuss the state EMS portal image trend that's going to go live in April. Do we have Lagia Castro, please? There we go, sharing screen.
Good afternoon, everyone. So we are moving to our new LMS pretty soon. So if you go into the ADHS website, you're going to see some new changes, and it's going to be easier to find us. If you search under I'm a healthcare provider, next slide, Shelley. If you search for the emergency medical care team and click on that, it will take you to our section, to our website. If you look on our page, the red banner, we have some information regarding our LMS. We'll be going offline March 31st because we'll be transitioning into the new system the following week. So keep a lookout for that. If you click on log into the LMS, it will take you to our site. Our website is also mobile friendly, so you'll have the same options, but it'll be user friendly. These are actually the services that we'll have available in the new system. The new ones that we'll have are the CON applications, the trauma-based hospital applications. We'll have the online complaint. We'll keep having the EMCT applications, the ambulance registration, along with the EMS training programs and course enrollment. And you can see in there a screenshot of what the portal will look like to access the applications for each of the different programs. And this is what the landing page will look like. We'll be adding more information in there on how to log in, how to claim your account. If you had a previous account in the current system, you'll be able to access that with all your information in the new system. And then we'll have videos and guides in there as well, showing the users how to claim their account, how to access the account, videos on how to create an account, and just to make the transition as smooth as possible for everyone. And we've gotten some feedback, so the system is pretty user friendly, so it will be a really good transition.
Great, thank you so much. Do we have any questions from the group about the portal? Thank you for that presentation. Okay, without any questions or comments, I do want to direct you guys to the chat. Sebastian put his contact information up about the previous agenda item in regards to the naloxone leave behind. So check your chat. Sebastian left his contact information if you have any questions about that item. And sorry, Sebastian, I just saw that chat comment, so forgive me. Next on our agenda is the National 911 Annual Report.
And Dr. Woolridge, this is Rachel. We really just wanted to share that for informational purposes and make sure folks have access to that report and data that is now nationally available. Next up, Julia Vinton has been working hard with the team on a strategic planning needs assessment. Julia, would you like to share some info on where we're at with that?
Sure. So the Bureau is working with the 4 regional EMS councils to conduct the 2023 statewide EMS and trauma needs assessment. The results of this assessment will be used to develop a statewide EMS and trauma system plan and 4 regional emergency medical services plans. The assessment will invite responses from 2 target groups, including individual EMCT organizations, which includes EMS agencies, hospitals, EMS training centers, and dispatch centers. Beginning today, we're able to share the link for the individual EMCT survey. This will be distributed widely via the EMS portal, as well as Gov Delivery and other methods. We invite you to participate in the assessment and share with those who may be interested in participating. If you have any questions, please feel free to reach out to me. I will put the link to the survey in the chat as well as my email.
Julia, I'm just going to amplify since I know we've had audio in and out this afternoon. We really want everyone to take this survey. We are going to encourage everyone, the entire EMCT workforce, all Arizona EMTs and paramedics to participate in the survey. We will be conducting an organizational survey as well. And the results of this survey are going to help inform our statewide strategic plan for EMS and trauma. So we look forward to participation and really, really value the feedback we get from the stakeholder community in this process. Dr. Bradley, are you on to talk about the EMS annual report?
Yes, thank you. Shelley, if you can go ahead and bring up the snapshot, please. And if we could also share a copy for the actual to the report in the chat, that would be great. Our previous meetings earlier today, we did go through the report more with Fox's assistance, but I did want to highlight the snapshot for the year. So we're not quite seeing that yet.
Oh, sorry, we're just getting it teed up right now. I apologize.
No problem. While that is getting brought up, I just wanted to highlight that Vox and her team have also been working at a real-time 911 dashboard, and that is very impressive. There's a link to that on our website as well. Thank you for displaying this. So this is our 2022 EMS snapshot. If we can just scroll to the top of it a little bit. Just to clarify so everyone is aware, it is available for 2022, but does include data from 2021, just based on the fact that data coming into the hospital discharge database is a little bit delayed. You can see the total EMS instances included in this analysis for 2021 were just over 1,100,000. And you can see our active EMCT certifications at 21,800, as well as new EMCT certifications at 2,579. We are looking forward to transitioning to our new EMS trend software, and I think this will allow us to have a better track of what our EMCT workforce looks like. We do have the breakdown of calls per day, which is approximately 3,000 incidents per day. And if you see pediatric specific information there, and a breakout of pediatric patients 0 to 17 is 6.2% of all 911 calls. And we have the primary and secondary impression categories of interest specific to pediatric population. You can see injury is a very high percentage at 19% of all pediatric calls. Respiratory distress at 8.8%, seizures at 6.4%. This is interesting when you look at adult versus pediatric seizure breakdown. Adults, it's 2.1, and pediatric patients, it's 3 times that percentage. And then also do track psychiatric illness, suicide attempts, and substance use disorder as well for the pediatric population. The map to the right is EMS incidents per population. By county, you can see La Paz County has the highest rate of incidents based on 100,000 individuals. And then going down to the bottom, we've got mortality of primary and secondary impressions. So just a brief overview, but wanted to make sure I highlighted some of the pediatric specific pieces that were added to the snapshot. And just a reminder that we'll make sure we add to the chat the link to the full EMS annual report, which is live on our webpage as well. Any questions regarding that? All right, thank you very much.
Thank you
Dr.
very much.
Brad.
Go ahead.
Thank you so much to Dr. Bradley and the team that has put together this annual report. It is a lot of information and it is really, really quality stuff. We especially appreciate all the agencies that submit the data to the AZ Peer system to make these reports possible. One last comment, Dr. Woolridge, we have on our Bureau report a link to ADOT 5-year construction program plan. We wanted to bring to the attention of all of our EMS and trauma stakeholders that there is a public comment period open until June. And we want to make sure that any feedback that the community has on the statewide construction program is heard during that comment period. So please feel free to share the link and submit your comments. That should round it out for the Bureau report if there are no questions.
Thank you very much. Are there any questions from the group? The audio is a little bit quiet. Is anyone else having a hard time hearing? If so, go ahead and echo out your questions. You can link to that report and the ability to make public comment from the agenda page.
And Dr. Woolrich, what I found does help a little bit is potentially try using some headsets. I don't know if that's helped anyone. I think it does help with some of the room audio being quiet. If anyone has those available, it may help.
Good suggestion. Thank you. Okay, we're going to step down to updates. Neonatal Resuscitation Program Project. Adam, are you available to discuss that?
Yeah, hopefully you guys can hear me. So a few updates. The first one here, a neonatal resuscitation program project. This is dollars that were left over from before my position was filled. This is carryover funding that was approved, and we are finally seeing it come to fruition in the form of neonatal resuscitation certification. This covers enough for 220 licenses. What this product is licenses for education, so sort of the way AHA does their licensures. And so it's a code redeemable for an online education for the NRP certification itself. We're working with a company called RQI who does a good job at distributing this for us because I have to make sure this goes out to 4 regions somewhat evenly. I don't want any one department or agency to get several of these licenses, so I'm trying to scale it proportionally. That is, so we're not quite finished there. That is coming up in the works. We're going to do, like I said, we're going to work with RQI on how to distribute this to the regions, and then I'm going to really lean on the regional councils to sort of sub-distribute this to where they think it's needed the most. And so it was noted that some of the equipment isn't present for the full employment of the NRP certification. But despite that, I think the increase in provider confidence is probably, in the pre-hospital provider confidence, is probably worth dividends. Any questions on that, on the NRP project? Great. Update B, we are still conducting our EMSC survey, so please encourage people to take that. I'll drop that link in the chat. Our data center gave us an options to choose from this year, and I chose an option where they make the phone calls instead of me, and we're exactly where we were at this time last year. So I'm going to start making phone calls and sort of bolster them up a little bit, but we're getting average response rate. Let me just say that. A few months ago, there was a request came in for which we are now calling EPIC cards, Emergency Pediatric Information Cards. And what these are, they're just sticky index cards with a bright color on them, bright orange or bright yellow, I forget which one they are. And they are to attach to your strollers or car seats or whatever you have, anywhere you would want EMS personnel to be able to access your children's information during an emergency. We ordered several thousand of those, and we'll set up sort of an online ordering process that you can drop your address, and we will ship you some of those cards. all that is also coming up soon. And then last, we participated, the EMSC participated in the NAMES Pediatric Symposium, which is a fantastic training offered by the Northern region. I think they're in their 15th year, which is incredible. It's 2 days. You get 16 pediatric CEs for this. It's divided into 8 hours of hands-on pediatric scenarios that NAMES does a good job at guarding those scenarios. We don't want any, they didn't want those scenarios getting out for preparation, things like that. And so in my opinion, it's some of the better training in the state for sure, because of that reason. You know, it's live good training from good instructors. The second day is lecture-based, and that's where the EMSC participated, was a bit of a data presentation. And so we are very happy to have been a part of that and included in that. I think I'm still, the slides I used in that pediatric symposium, we're still waiting for the, oh no, never mind, any questions about the updates?
Our honorary team member has joined us, our honorary committee member.
Okay, Dr. Horwich, if nobody has anything, go ahead and move on to discussion action items.
Yeah, if there's no other questions, thank you, Adam, for those updates. Our next agenda item is to discuss, amend, and approve our meeting minutes for November 2022. If I could have a motion to review those meeting minutes in a second, please.
Mr. Dana, I'll motion.
And a second.
Seidler, I'll second.
Great, thank you. Thank you both very much. So as you can see, as displayed, our meeting minutes from the November meeting. It's open for discussion at this point. Anyone has any edits or updates for those minutes? We'll give you a chance to scroll through them briefly. Okay. In the absence of comments or edits, I would ask there be a motion and a second for the approval of these meeting minutes, November of 2022.
Seidler motion.
I'll second, Mr. Dana.
Great, thank you very much. Okay, for those in favor of approval, say aye.
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 Okay, is there any? Thank you. Anyone in opposition? Any nays? Any abstentions? Okay, the November meeting minutes are approved. Thank you very much. Okay, next on our discussion is our behavioral health slide set. Adam, I think that's you have the floor.
Yes. So we want input and feedback. This is from the behavioral health work group. This has taken a little bit longer because during the creation of our last education module, our EMSC data center released training that was very parallel with this. And so we went back and sort of revamped it and crosswalked it in a similar fashion to the seizure training that was mentioned in the earlier meetings. And so taking feedback corrections for the pediatric behavioral health emergencies to move forward to EDU. So I will kind of move through it and let me know what you guys think. This image is taken from the Arizona School Report in 2021. Developed for us by Image Trend. This is sorry, go ahead, Dr. Ward.
What I was going to say that this is a discussion item. Adam is showing the slide set. If there's any comments from the group, Shelley, you can help me here if we're in order after our review to be able to make a motion to approve this. If that's appropriate order, that would be our next step. But right now, we're just reviewing as a discussion item.
I think it's on the agenda as discussed, amend, approve.
Okay, great. Okay.
You have a motion already, and you guys are gonna make your amendments now, and then you'll vote on the presentation with amendments, if there are any.
Sure. Thanks, Shelley. Real quick, this slide is taking elements from the Department of Developmental Disabilities. They have an excellent training series of modules designed specifically for EMS and first responders. And so I feel like the inclusion of this slide is really important to try and start building the tools. And these are, I mean, I think these are going to be verbal tools that the paramedics using. It's not, this behavioral health issue isn't going to be a medication or a setting on the monitor. It's going to have to be something where we're discussing with these patients using de-escalation techniques, and that's exactly what the slide is here for. So it's a walkthrough of several different of the most common types of developmental disabilities and how EMS can approach them. These links do indeed work. If you, when I do send this out, when it does get approved, when you go to slideshow mode, the links do become active, but they don't look like it when they're here in the.
Yeah. The file attached to your agendas, that PDF, those all those links are functional. This is open access, and I'll just repeat Adam's comment. It's an excellent resource for each of those modules.
Thanks for that. Resize this, copied over a little goofy. Okay, and then the second major resource is the data center that I keep mentioning. This is from our EMSC data center. This is a webinar that's led by Dr. Marianne Gosh-Hill out of, she's a physician in for LA County Fire, I believe. And this is a stepwise approach to that agitated patient coming from those toolkits from a data center that I want to make sure that we are trying to bring as much light to as possible. So these are all clickable links that when in presentation mode or when in slideshow mode become active, so you can have a look at that. Couple of links here with more information. It was a bit too much for this slide set, but for follow-on information, some links there. Not sure if the committee wanted to talk about adding an entire slide about abuse and neglect, since we're sort of in the space a little bit, but that I realize that can kind of tangent off pretty quickly. So So a relatively short slide set, but an awful lot of links and resources therein. Sorry, Dr. Roach, go ahead.
No, go ahead, Adam. You summarize, if you don't mind.
No, go ahead.
Yeah. So, well, I'll just extend on what Adam was just saying, that, the series of links in the modules, there's videos, there's additional links to slide sets. So although this is a short slide set, it's the linked material that makes it pretty robust. Again, this is a product of our behavioral health work group. So thank you to Adam for coordinating the assembly and all the input from the work group. Are there any questions about the slide set? Any edits or concerns? Anything for discussion? Okay. In the absence of further discussion, I would like to move us, I would request a motion and a second to approve the slide set, and that would ultimately sunset our behavioral health work group. Can I have a motion, please?
You can go ahead and vote on it. The way
Okay.
it's listed on the agenda,
Okay.
you can proceed with the vote.
Okay. So if I could have people's votes to approve would say yay.
Aye.
Yay.
Aye.
Aye.
Yay.
Yay.
Paul?
Okay. Any nay votes? Any votes in abstention? Okay. Understanding the number of yay votes, I think that met approval. Is that correct, Shelley?
Yes, with your voice vote, you had the majority approving.
Okay, great. All right. So wonderful. So slide set is approved and the behavioral health work group is sunset. Thank you all for that. Next are our standing items, discussion to amend and improve work groups and work group topics. Adam, do you want to discuss these?
Yeah, actually, the first two probably should be together. I and double I should be together. But in one of our most probably one of the most intensive grant deliverables that we have coming up is the stand-up of an EMS recognition, pediatric recognition program. This is the mirror to our hospital-based pediatric recognition program. Luckily, the EMSCs are pretty good about we use Basecamp to communicate, so all 50 or whatever of us communicate on the same platform, and nobody's trying to reinvent the wheel. So these are the major takeaways that all of the other programs have in common, and they're pretty reasonable. So in the work group that we are going to solicit for members for today, some of the things we can expect to work. Well, let me give you an introduction of what generally these programs contain. So this first list here is a common program element to each of these agencies recognition programs, and these are mostly universal. There's only maybe one or two exceptions throughout the entire country, but the designation of a PEC, which can be anybody of that agency with a particular interest in pediatric care. Some statement on pediatric education skill competency. I say some statement, I'm sorry, some policy regarding the rotation of this training. Any community outreach program, and there is a myriad of outreach programs that they can choose from. Most of the time it's school presentations or helmet campaigns, CPR classes. That's what we found was the most common. Another component is pediatric equipment standards, and this is the EMSC program across the country universally utilizes the MPRP toolkit put forth by the data center. When I looked at that toolkit, the toolkit references national standards for pediatric equipment. So it's kind of like a two-way arrow. It's the national, so it points back to national, and so we just say what's national. So I think we might have a little bit to talk about as far as any particular equipment goes, but we'll deal with that when we get there. Let's see. Some policy regarding safe transport of pediatric patients. This is one of the areas of lag in EMS is that we don't have good transportation policies or even equipment for pediatrics at this point that's broadly used. And so we used the NASIMSA document developed in 2017 as the best interim placeholder for the safe transport of children. And then some sort of agreement for data collection for our survey purposes and things like that. Thank you. And the Pediatric Prepared Emergency Care Program is the hospital side of this right now. So essentially we're standing up the EMS side of this. And I don't know if it's going to have the exact same name, Pediatric Prepared Emergency Care. I don't know about that particular, but this is that mirror.
Okay, thank you.
Yeah, you're welcome. Good question. It was important that the states all made a disclaimer to those who are participating, and that is that their status with the respective bureau will not change depending on their participation in this program. It's important for us to say that to them because we don't want to scare anybody off.
And just to clarify, so the new cycle of the the new cycling of the EMSC State Partnership Grant, this is one of the benchmarks. Kind of a challenge for NEDARC is to establish a recognition program in the pre-hospital environment as a component of our national membership with EMSC. So distinct to the pre-hospital environment. I hope that clarifies.
Yes, thank you.
Recognition status, 2 years was average. Some states do slightly shorter. And then some states that have had these programs stood up for a period of time have multiple layers to their recognition, meaning they can have a basic recognition or advanced recognition, so to speak. And so I think the work group can discuss the merits of that or the timing of that as we get there. And then lastly, these are the general components of their application review process. The EMSC reviews these packages set forth by the agency. That EMSC will take it to their Pediatric Council. The Pediatric Council will then discuss that agency and either award the recognition or another path. We have to have some process of renewal, and then we have to have some process for appeals for denied applications. And those are the major components. And so the effort of this is going to be getting this so it's coming from our bureau, getting it, producing all these documents. Typically, there's other states have handbooks that come along with these that are upwards of 15 and 20 pages long, in addition to several other things that need to be in place. So there's a lot of work here to be done. And it will definitely require the input of quite a few of us to really stand up effectively. The time frame for bringing on our first EMS agency, we'd like to look in early 25, if we could, for the actual launch of this program. Public facing side of this program would be looking about 2015.
So just to clarify, so this would be a completely separate certification program. Does it make sense to have two separate, or should it be something that we consider to add to the PPEC program, right? I'm just thinking this through and thinking, so we're going to ask hospitals to have a pediatric prepared emergency care program for the hospital and then have a separate recognition program for pre-hospital?
Oh, sorry, Dale, go ahead.
Well, this is essentially a motion to establish that work group to see how Arizona is ultimately going to do this. Adam is summarizing what some of the other states are doing. The challenge from EMSC nationally is that each state would approach this and to create their own system. The majority of these focus on the EMS agency, not the hospital. The EMS agency themselves, so the fire departments essentially, regional throughout the state, would essentially establish kind of a parallel pediatric emergency, care coordinator or the champion within that unit, but it wouldn't be hospital based.
Okay, thank you.
And Adam, clarify, because you've done more homework on what some of the other states are doing. But again, this is a work group to essentially bring stakeholders, establish kind of a workflow and a process of how Arizona would approach this in the timeline that Adam summarized.
Thank you.
for that, Dr. Woolridge. And a little bit more to your point, in the initial rollout, the EMSCs discovered it was easier to have them be independent and then integrate rather than try and integrate on the rollout. For example, we have the Premier EMS Agency program here at the Bureau that it would be one of the first things we'd look at stitching together. But in the development of it, I wouldn't have the technical expertise to navigate all of the details, trying to bring those two things together. And so, yeah, I agree with you. It seems a little odd to have independent programs for the same thing, but I think it might help with ease and timeline in those regards.
Thanks for the clarification.
Yeah, totally. Teresa, I see your hand up, and Debbie, I see your hand up.
Yeah, I just have a question about the cost for the recognition, because in the past, we when we were funding hospitals directly, those that were participating in becoming pediatric prepared were able to utilize the grant funds to offset the cost. And I think at the time it was $1,200 or $1,500. And I'm just wondering if there is a current cost right now, and if so, how would you handle the request to assist with to become recognized as pediatric prepared? How will the associated cost be handled if there's an ask for it?
Right now, there's no cost associated with participation in the program across any state, to my knowledge. That what you mean, like membership fees? Is that kind of what you were?
No, with when we were working with Tommy St. Mars and we were trying to increase the number of facilities that were recognized as pediatric prepared, there was an associated cost from the hospitals for that. And so I could try to find some background on it, but if there's no associated costs whatsoever, then I guess it's a non-issue. But if there are, I know that might be a showstopper for some.
So Teresa, it sounds like you're referring to the program at AZAP about pediatric prepared emergency care, where there's a fee for the hospitals. Correct?
I don't know about that. I just know what I did with Tommy when she worked at the department and ran that program, that grant. I don't know about the other one.
That it's the same thing. It's the same program. It's the pediatric prepared emergency care. But if I'm understanding Adam correctly and Dr. Woolridge correctly, what they're proposing here is a totally separate program for pre-hospital.
Great.
Yeah.
So this is Debbie. I think Teresa, I can answer part of that. Yes, there was a cost for hospitals to do some of the training, some of the equipment, especially the rural hospitals who maybe really didn't deal with a lot of pediatric patients on a regular basis. Sometimes it was seasonal. And so we did have a hard time bringing some hospitals on board. What occurred in order to incentivize hospitals is the Access Administration, and this may have been money that Tommy was able to get over to Access, but how the money flowed to hospitals was through a differential adjustment payment attached to their Medicaid claims. And so it gave hospitals a little bit of a rate bump to be pediatric certified. And so that's really is what helped bring more hospitals along. And so I don't know what costs the EMS agencies will incur in order to become certified, but if there is a cost, that was going to be my question was, have you had initial conversations? Have the EMS agencies said there's going to be a cost, and how are you guys looking at that?
Yeah, that's absolutely something we're going to have to just find out. Maybe we can do a series of pilot agencies for this, and then determine what kind of costs were incurred on them to try and get up to speed with this recognition program. From my research, though, it doesn't look like the agencies are going to have to make any major purchases to make this happen. The most major I can see would be perhaps transport specific items like a literal car seat for the ambulance or an actual transportation device for pediatric that might be equipment that the departments don't have already. The vast majority of equipment the departments have already. A lot of this is policy driven, and I don't want to say policy driven like entirely just floating in the air, but a lot of it's policy driven, and the only real purchases I can see are transport particular devices. But that's an interesting point. I hadn't considered what kind of startup monies this might be on the other side for our agencies.
Yeah.
We haven't had any discussions yet. We're still in the approval of the work group to have these discussions.
Yeah.
So we're still in the really early.
Yeah, thank you for that clarification. The work group hasn't been established. So for those who envision a certain strategy or style going forward, I would encourage you guys to participate in the work group. Again, this is a discussion, exploratory. The work group is going to explore what's feasible in Arizona. And that's, and to be honest with you, you guys are reflecting back on essentially the pediatric champion in the hospital setting that generated, 6-8 years ago and has evolved over time. This concept through EMSC National is to look at the pre-hospital environment, the individual EMS agencies, and to essentially see how they can establish, that pediatric champion. Now, the Kentucky program, which is one program that we had looked at, essentially created a toolkit. And that was a toolkit that served as a resource to the individual EMS agency. Each agency, it benefits them to be able to have pediatric, obviously, skill sets, ability to care for the individual pediatric patient. But what can we offer centrally as a resource? So is that going to be a toolkit that we offer out? I don't see this being a funded issue, so I see it being more grassroots. But again, the work group hasn't been created. I think all this needs to be discussed as far as what's been done in other states and what can be feasibly applied in Arizona, and what resources can we offer to the individual agencies through the individual EMS regional councils.
When thinking about bringing together the work group, I'm trying to remember way back when we first developed the program for the hospitals. I remember one of the issues that one of the proposals, and I wish I could remember which one, it became very clear to me that it wasn't going to work for rural hospitals. And so we did some modification. I don't know if that's going to be the same thing with EMS agencies, but I would just encourage, when putting together the work group, that you do have that urban rural representation, just in case there are differences, without sacrificing patient safety.
Yeah, I agree. Arizona has such a huge rural area to cover, and it's the smaller agencies that sometimes struggle when it comes to those resource-related issues. So I definitely agree with your sentiment. Any other comments from the group? Any other questions?
Dr. Woolridge, we did form the work group during the last meeting. We can solicit for volunteers for that work group now if you'd like.
Oh, did we already
Sounds like
vote?
people are interested.
Okay, all right. So we have voted to be approved. The agenda confused me a little bit. I kind of interpreted that we had to vote again, but if we've already voted.
We did form the work group the last meeting, so it exists technically.
Okay, all right. So what I would ask the attendees to reach out to Adam. Adam, if you don't mind putting your email into the text chat, and contact Adam, and then we'll be scheduling this work group to essentially discuss pitfalls, what's feasible going forward, and if we can get all of the stakeholders involved, I think we can be productive going forward in establishing a program in Arizona. again, tailored to Arizona's needs. All right, any other comments?
Someone in the chat said they would help, but it says unknown. Their name is unknown, so I apologize. I didn't pick up from that.
Heather Miller.
Okay.
Okay.
Wasn't Heather Miller,
Thank
right?
you. Sorry, I was just putting that in.
Okay, well, while you guys are doing that, step us to our next discussion item, bylaw reviews work group. And this was discussed in our last meeting to essentially establish a review work group to assist with the review of the bylaws. Additional committees are looking at the bylaws also. Obviously, PACES would want to focus on the pediatric specific components of that, but to be able to participate in the bylaw review group. And again, if you are interested in participating in that work group, please contact Adam, and Adam's email is in the chat. Okay. Our next discussion item is the RSV flu surge.
Yeah, thanks. I put this in the agenda just because I thought it would help shed some light on the complexity that was the pediatric surge over this last winter time. This information comes to us from our data center in collaboration with the Pediatric Pandemic Network, and they did a good job at summarizing some of the things that culminated to occur for the pediatric surge to be as bad as it was. So take some time and have a look through this. It's very fascinating. It was to me, and that's why I chose to put it in here. I don't know what I'm trying to accomplish with it, but I think it's important to bring to light some of the processes that happened to arrive at the pediatric surge.
Adam and Dr. Woolridge, this is Rachel. We were notified this week that the University of Arizona, who runs the REACH Coordination Hub, they are stopping service on the pediatric surge line because they just don't see a demand. The hospitals have shared that here in the state of Arizona, they are able to handle the pediatric surge. So the University of Arizona REACH pediatric surge line is being discontinued, although the U of A will continue to offer rural transfer service to the critical access hospitals and the IHS 638 facilities that do need it. That part of the service will remain intact, but I thought it was good news that we heard that the pediatric surge line was not necessary at this point.
Yeah, numbers are down. That's great. Thanks for letting us know. Great. Thank you. Okay. Any questions for Adam in regards to RSV flu surge? Okay. All right, moving on. We have any agenda items to be considered for the next meeting. If you would please send them to Adam. Again, Adam's email is in the chat. Is there any agenda items that people would like to suggest now? Oh, we have a hand raised, Teresa?
Yeah, this is Teresa with ADHS. I really think it would be of benefit to discuss the rescission of Title 42 with regard to border releases or asylum seekers, and also the rescission, the ending of the public health emergency declaration. As you know, we get a lot of pediatric patients, if you will, as a result of a trek across the desert. And with the rescission of Title 42, the potential for not only surge at medical facilities, but street releases and an awareness for EMS as well is, I think, worthy of discussion with this group. If anybody else has some comments or other dialogue that they'd like to go along with that, please feel free. But I think it's worthy of at least a discussion amongst this group.
Yeah, okay, thank you, Teresa. We can definitely get that on the agenda for discussion for next meeting. I appreciate that.
Yeah. Yeah, I think in the interim, probably need to do a little bit of fact finding based upon impact in Arizona particularly.
I can send you a pretty good summary from the last Southwest Border Health call that Arizona participates on. We get a lot of updates too from Dr. Cullen at Pima County. It involves also, some concerns within Cochise and Yuma. But, what they reported out at the last call was an increase in hepatitis A, varicella, and the COVID percentages are much higher as Pima County continues to test everybody, but their COVID hotel is full, and that's 284 rooms. And so I think with regard to the pediatric patient and teen pregnancies, it would just be helpful to get some insight. And I like I said, I'll forward you the latest from the Department of Homeland Security, who runs the border health calls, or Southwest border calls on health.
Yeah, that'd be very helpful. Thank you. All right. Any other agenda items that people would like to suggest for our next meeting?
Dr. Ziegler, did you want to propose a work group?
Yeah, so, and I'm not sure how this works, but it might be worthwhile having a educational topic on the agenda so that we can discuss this each meeting. And I had sent an email a couple days ago to a few people talking about an interesting discussion that we had with our EMS medical director group in the central region and pediatric airways and the comfort level with EMS providers with pediatric airways. I thought that might be our good educational project, a good upcoming educational project.
Sure. Let's. I think that's a good idea too. I think pediatric airways can't get enough attention. So let me add that to the next agenda for further discussion. Is that okay?
Yeah, I mean, and maybe just an open agenda item that talks about any educational projects that people bring up. Otherwise, we're kind of 3 months behind if we want to propose it for the agenda and then.
Yeah, I see what you mean. Okay.
Yeah, thank you guys for the consideration. And I saw some other emails that we'll start looking at some basic information for that and then talk about it more next meeting.
Okay. And you're absolutely right. I mean, one of the things PACES has been productive with is establishing work groups that have created essentially a product. Earlier in the meeting, you saw the behavioral health slide set that we established or created through a work group. So I'm guessing the way you're talking about it is you anticipate maybe a module being developed, or if ADHS already has a module that we could augment it and essentially revise and update it. Is that kind of what you're thinking of a product?
Yeah, exactly.
Okay. Well, I would ask to put on our agenda these that we have this as kind of a voting item, the establishment in our next meeting, establishment of a work group for that educational task.
Okay. Sounds good.
Good idea.
Thank you for that. Call to the public. Anybody have any announcements? Any events coming up? Any accolades that you would like to send out to anybody? Adam, thank you for the kind comments about the NAMES conference. I attended, as well as Chris was there. I'm sure others were also, and it was a very good conference. on the upcoming events in the agenda you have displayed on the screen. I will not read them all to you, but quite a number of activities there and events. Any other announcements? Call to the public, please. Okay, well, our next meeting will be July 20th at 1:30. Location to be announced, but I'm sure we'll have an online capacity for a hybrid meeting. And without any other further comments from the group or the attendees, I will call to adjourn the meeting.
Thank you, everyone.
Thank you.
Thanks, everybody.